Ladies and gentlemen, the presentation of the awards will begin in a few minutes. Please enjoy this short video highlighting the immunization activities from this past year and our immunization champions before we begin the program. Good evening. I'm Mitch Rotholtz, APhA Chief of Governance and State Affiliates, as well as the Executive Director for the APhA Foundation. And on behalf of the American Pharmacists Association, I welcome you to this evening's award celebration. This is our 14th annual APhA Immunization Champion Awards ceremony. The program was created in 2008 and first awarded in 2009 to recognize the value and extraordinary contributions pharmacists provide to improving the public health of our communities and the individuals we serve. We are fortunate to be able to have this ceremony this year live. Live because of the work of many of you in this room. This award ceremony has no greater significance than this year, coming out of COVID, 2 years of stress, stretch, but dedication. And so each of you, with your teams, have gone over and beyond to serve the healthcare needs of individuals and communities. We have demonstrated when pharmacists are given the authority, we deliver, and we delivered big. Pharmacists have demonstrated the true meaning of immunization neighborhood. And those of you who've known me since 2012, APhA has advocated for the concept of the immunization neighborhood. The collaboration, coordination, and communication among immunization stakeholders who who are dedicated to protecting their communities and individuals from vaccine-preventable diseases. We saw the immunization neighborhood play out in communities across the country, where pharmacists, pharmacy technicians, student pharmacists, nurse practitioners, nurses, physicians, public health, and non-medical individuals coming together, standing side by side, shoulder by shoulder, serving the needs of communities. That's what is meant by the immunization neighborhood. And each of you are champions in that cause. And on behalf of APHA and the profession, thank you for all your efforts. Getting to this point has taken the profession, with APHA at the helm, more than 26 years. And since 1996, APHA's pharmacy-based immunization certificate training program has prepared more than 400,000 pharmacists and student pharmacists, and now during also COVID, more than 100,000 pharmacy technicians to administer vaccines across the lifespan. And before I move further into the script, there is a group in this room that I do need to recognize, and that are the APHA staff who work on that program with all of our partners to deliver those programs. We couldn't hit those numbers without a strong team, with your teams and our team working together. So let's just congratulate the APHA staff, and some of them are up here. Thank you for your work. Having that training program, we were ready. We were ready when COVID hit. So we didn't have to go back and retrain on how to administer vaccines. We were ready. And that's why the government recognized, and some of our award winners this evening recognized that, and you'll see that in a few minutes. So when it comes to immunizations, today is the day. Today is the day for the optimization and sustainability for pharmacists, immunizations, and our role in public health. We don't have to prove anymore. We were there. We made the impact, and so let's continue that and grow it. Tonight is a night for recognition and celebration. While there are a few individuals and entities who will be recognized specifically this evening, each and every one of you deserve special recognition, and we applaud you for your efforts. You will hear some special individuals and entities selected by this year's awards committee. I did not have any role in selection of individuals. And I want to say that because there's some of these individuals who are selected this evening who I worked with, made sure that people saw what they did, but really, I just facilitated. I'm your MC this evening. So all of the winners, I thank you for everything you've done. All of the teams, thank you for your efforts as well. And so many of you have contributed to getting us here this evening. So it takes a collaboration and cooperation to obtain the immunization successes that we've achieved to date. Our partners from the government and vaccine industry recognize the important role pharmacists play in the education and administration of vaccines, including addressing vaccine confidence. Actually, the term vaccine confidence, we are starting to use another word to address vaccine confidence, to address vaccine hesitancy. We're terming it vaccine contemplation, working with the public to come up with, when they're ready to be vaccinated, we're there to help. Giving them the confidence in the vaccine, giving them the confidence in how it will protect them and their families and their communities. Giving the information, we are seeing that public is coming around to make the decision to get vaccinated. But it doesn't happen overnight, as each of you know in the work that you've done in your communities. So in terms of taking the collaboration with our industry partners, I want to thank this evening. This event was made possible with the support from CDC, GSK, Merck, Moderna, Pfizer, and VaxServe. Let's give them a round of applause. Our partners help amplify and support our work and the reach of our efforts. Thank you for your support. We do have a special message from one of our supporters that really represents what all of our partners who work with us feel about pharmacy. So if we could play that video.
Hello, pharmacists, student pharmacists, technicians, and friends of pharmacy. My name is James Mancy, Vice President, Medical Affairs for the Americas at Moderna. Moderna is delighted to celebrate the 2022 Immunization Champion Award winners and to be a sponsor of this reception. The individuals and organizations that will be recognized tonight have made extraordinary contributions to protect the communities they practice in and have overcome challenges created by the pandemic. The dedication of these award winners and the entire pharmacy profession to protect the communities you serve inspires all of us at Moderna, and we are so grateful of your efforts. At Moderna, we know there is a big difference between vaccines and vaccination, as well as the importance of bringing vaccination to where patients are. Both have been highlighted during the pandemic, and the pharmacy profession has been cemented as the key healthcare provider in the immunization neighborhood. On behalf of my Moderna colleagues, I want to take a moment and say thank you. Thank you for all you do to support patients across this country, especially over the last year. We appreciate your dedication to helping patients throughout the global pandemic and ensuring the continuity of care for millions of people with chronic conditions during an unprecedented public health crisis. The theme of the APHA annual meeting is celebrating all of pharmacy, and tonight, Moderna celebrates you, our COVID-19 heroes.
It's now time to begin the awards presentation. Background on each recipient is contained within the awards booklet that you see around the room, as well as outside on the table as you walk in. Please pay attention to the sampling of innovative activities contained within the booklet. I ask that the award winners please come back up to the front of the room for a group photo at the end of the presentation. I am pleased on behalf of APHA to present this year's award recipients. The first category presented this evening is the individual practitioner. As the title indicates, these individuals exemplify the impact pharmacists have on patient care and positively portray the value of pharmacists' public health activities. Our honorable mention award recipient this year, Jacinda Abdul Kabir, has dedicated her career to improving immunization access, education, and vaccination rates, especially among minoritized populations and communities. Since December of 2020, she has been mobilized in helping address concerns of individuals within her community and vaccinating minoritized communities, decreasing barriers to access. Jacinda leveraged relationships with faith-based and community influencers to increase vaccine uptake among these communities, Black and Latino groups, and individuals who are at risk. Jacinda was the lead author of an article published in the Lancet Global Health and is an active educator in webinars throughout the pandemic and beyond. She shared her experiences very freely and strategies with participants. She is an example for many of the importance and influential role pharmacists can play in immunizing their communities. Unfortunately, Dr. Abdul Mutakabir is unable to be here this evening, but accepting on her behalf is Michael Hogue, Dean of Loma Linda University.
Hello, my name is Dr. Jacinda Abdul Mutakabir, and I'm excited to be a recipient of this year's Immunization Champion Award. At Loma Linda University, we noticed the disparities of Black vaccinees. Therefore, we developed a concentrated approach to increase the number. With this, we decided that it would be important to center our minoritized healthcare providers to go ahead and make sure that we increase those number of vaccinees. But not only that, that we worked hard to develop and a trustworthy and transparent relationship with the Black and Latino communities. Therefore, we developed a three-tiered approach at Loma Linda, one that included the engagement of faith leaders, the second that included the information delivered from a Black pharmacist, and then lastly, the delivery of vaccination clinics in these minoritized communities. So with that, we were able to really engage the community as stakeholders within our vaccine clinics. But not only that, we were able to vaccinate over 2,500 Black and Brown individuals. Those that were previously underrepresented in our large vaccination clinic effort were now overrepresented in our vaccination clinic efforts. Not only that, but we have continued to provide education to the communities in terms of the vaccines, especially as we enter into the rise of the Omicron variant. We've made sure to continue to provide these communities booster doses. In terms of challenges, however, we've been met with, of course, what everyone has seen is a decline in the receipt of vaccines. So with that, we've made sure to also streamline our approach. We've developed strike teams at Loma Linda University, which include us actually going into the homes of those individuals of minoritized communities, those that would not be privy or would not have access to the vaccinations otherwise. But we have done this with students so that we could also increase their education and raise a new generation of empathetic and equity-minded clinicians. So, with that being said, I'm honored to be able to contribute to the new way that the public views pharmacists. Pharmacists are public health change agents, and I'm so happy to contribute to that. I'm so happy to be an advocate, to be a trustworthy messenger to Black and Latino communities. And I hope that I can continue to do this work, and I hope that I can continue to show how important pharmacists are to making equity a reality.
Our next national recipients are Alexandria Rothy from Pittsburgh, Pennsylvania, and Jordan Smith from Carmel, Indiana. Alexandria is an independent community pharmacist who serves underserved patients with an average health literacy level of the 6th grade. Her persistence and advocacy on behalf of her community led to her practice receiving necessary vaccines and improving access to community members. The pharmacy team offered vaccine clinics and brought vaccinations to individual homes. She took every phone call with questions about the efficacy and safety of the vaccines and spoke with confidence to reassure and educate patients. Her clinic provided 13,000 COVID-19 vaccinations. In recognition of the impact of hers and her family's efforts, the City of Pittsburgh issued a proclamation naming June 2nd as Hilltop Pharmacy Day. Please welcome pharmacist Alexandria Rothy.
Hi, my name is Alex Rothy, and I'm a pharmacy manager at Hilltop Pharmacy in Pittsburgh, Pennsylvania. These last 2 years have been a time of struggle, but also a period of triumph and advancement for all of us in the pharmacy profession. We were presented with an opportunity to show on a nationwide and worldwide scale just what pharmacists and pharmacy can really do when challenged. We are and always will be familiar faces within our communities, but we also are advocates for our patients who may not be strong enough or capable enough to advocate for themselves. Community pharmacies are a one-stop shop for advice on all sorts of ailments and healthcare guidance, all while being constant pillars of resilience and stabilities when our patients and communities need them the most. If you would have told me when I graduated from pharmacy school that I would soon be partnering with city officials, fire departments, EMTs, police, physicians, medical students, dentists, chiropractors, pharmacy students, technicians, and hundreds of neighbors and volunteers who all simply wanted to do one thing, and that was lend a helping hand and begin the healing process of this beautiful city, I would have told you, I'm just a pharmacist doing what I love, and what's a pandemic? But here we are 2 years later, and I couldn't imagine my life nor my practice without all these remarkable, phenomenal, committed, and dedicated individuals who helped make this all possible. So what I learned during the pandemic that I feel has definitely benefited me, and I hope it will others as well, is one, reach out. When the pandemic started, time slowly started churning away, and we basically lost all of 2020. But I started to put together a what can we do once the vaccine arrives list. I had always planned on having clinics, and like many of us did, I knew I couldn't do it in my tiny pharmacy. We lacked adequate space, facilities, and staff to bring people in without severely affecting our workflow. What started out as a simple gesture of, hey, I have a few extra vaccines, can we help vaccinate your most at-risk first responders, turned into thousands of vaccinations for our city's first responders and eventually their employees. As the pandemic progressed, I reached out to a variety of other individuals looking for help. This progressed to us holding clinics in places like bars and restaurants, and then slightly larger places like churches. And lastly, we were able to hold clinics in huge community centers, vaccinating up to 1,200 people in a single day. Working with the city, we were able to provide sites for patients who were either unable to travel or had language barriers, and also identified about 100 homebound patients who were unable to get the vaccine through any other means. The second thing I learned is ask for help. Asking for help sounds so simple, but it can feel quite the opposite. My pharmacy is located in an underserved and economically disadvantaged community within the city of Pittsburgh, and we struggled to find a place large enough to hold a clinic for our community. Within some time, a suburban community had reached out to offer us their community center. However, it was well outside our section of city. We were thrilled to have access to such a large and modern facility that could easily accommodate a huge number of people, but it put many of my neighborhood and the physically disadvantaged patients that I served at a distance because they couldn't get there. In attempting to find a solution, I had reached out to our local business alliance to see if they had any ideas or suggestions. They had been receiving a vast number of calls as well to try to get people vaccinated. Then we came up with a solution. The business alliance has access to buses, and not just any buses, but buses handicapped accessible. That's allowed us to transport pretty much everyone we needed out to get vaccinated at this community center. In a short time, with the help of the Business Alliance, we ended up busing about 60 of our most physically, emotionally, and economically challenged residents to this community center. They not only got the vaccine, but they were able to see family and friends that they hadn't seen in almost a year. The tears in their eyes and thank yous are something I'll just never forget to this day. Lastly, all I can say is plan ahead. Always think of what might happen next and what might go wrong or what might fail. Every day, every clinic and every patient presented a new challenge. We thought through many internet outages, lack of outlets for computers, and then those computers going down, or patients trying to get vaccinated when they just weren't quite qualified yet. Do your best to think ahead, but don't be afraid to roll with the punches. Preventative vaccines like the COVID-19 vaccine can make a life-saving difference in a patient's health and well-being, as well as protecting those they love and live with. We as pharmacists have a really unique platform within our communities to offer sound medical advice in a safe and comfortable environment. Don't take that for granted. For some patients, all it takes is a simple suggestion of, hey, did you get your vaccine yet? But for others, it takes more time, effort, and patience to achieve that goal. If this pandemic has taught me anything about myself and this profession, it's speak up and stand together. Each and every day, we felt we made an impact, even if we were only one store, one pharmacist, one technician, and some students. As individuals, we didn't have all the answers, but by reaching out, asking for help, and planning for ahead, we were able to cultivate and utilize the talents and resources of others within our communities and neighborhoods. Talents and resources we didn't know we had before. By coming together as a team, everyone was able to help change the course of the pandemic. That's why we all gather here today, and we'll be able to do so in the future. Thank you.
Hi, I know I just talked for really long on that video. I'm sorry, they told me 2 minutes and it was way too many things to say. I just wanted to give a quick thank you to some of the people that have supported me. I could not have done this without my parents. They have been the biggest support for me. I was raised in a family of pharmacists and shockingly I followed in their footsteps. My dad, Pat, and mom, Jill, have been an incredible rock for me. They gave time, effort. They were up at 5 a.m. drawing thousands of vaccines for us to get this going. My husband, Andrew, sat through countless teary nights of just me on the floor breaking down and picked me up, put me in bed, gave me a cheese stick and said, we're gonna do it tomorrow. And lastly, my student Natalie Kleck is here from Duquesne University. She's awesome. Don't underestimate your students. They're here to help, they're here to listen. You know, you wanna talk about where we got a lot of our strength from. The students that came out of the woodwork were awesome. So guys, keep pushing, we're getting there. We got provider status on the way. We got friends and family now looking for us. Now all of a sudden, we had physicians helping us. It was awesome. So keep working, we got this, and thank you to my family. You guys have been awesome.
That's what you call passion. Thank you, Alexandria. Our next recipient is Jordan Smith, who manages 240 pharmacists, 470 pharmacy technicians, and 60 interns in central Indiana. In partnership with CDC, she was responsible for ensuring end-to-end site clinic services and compliance for 184 long-term care facilities in the Indianapolis area, providing more than 24,000 COVID-19 vaccines in over 3 months. Jordan simultaneously coordinated in-store clinics across the state for Indiana's Division of Disability and Rehabilitative Services. She partnered with Purdue University's Center for Health Equity and Innovation and a food bank designed and piloted as a drive-through COVID vaccine model for people experiencing food insecurity. When language barriers were identified, she found creative ways to identify and recruit Spanish-speaking individuals to meet her community's needs. Her unwavering commitment to communities is evident in all that she does. Please help me welcome Jordan Smith.
Hi, I'm Jordan Smith. I'm the healthcare supervisor with Walgreens for the Indianapolis area. Through the pandemic, we have often been the most relied upon and accessible health providers for patients seeking the COVID-19 vaccine. Pharmacists have played a critical role in providing access to vaccinations in underserved areas, given the disproportionate impact of the pandemic on these communities. While this award is for an individual practitioner, I must say that it is certainly not a one-person effort. My passion for health equity aligns with my company, and we are committed to driving equitable access to all vaccines. My job provides a platform and empowers me to employ innovative vaccination efforts to reach our most vulnerable patients. I transitioned into my current role in December 2020, coinciding with the initial vaccine launch. We've serviced 192 long-term care facilities, 3 times each, spanning most of Indiana. This crossed over into off-site clinics with interested employers, and then coordinating in-store clinics with Indiana's Division of Disability and Rehabilitative Services to accommodate their clients' needs. We also coordinated off-site clinics at local deaf clubs across the state, allowing us to reach a large portion of our deaf community. In March 2021, I had the pleasure to begin working and collaborating with Purdue's Center for Health Equity. For almost a year, we have been on a mission to bring access to COVID and flu vaccine to communities and populations that need them most. We service various food banks across the state, homeless shelters, and churches, and continue to seek and capture other opportunities and populations with a need. As pharmacists, it's important to understand and identify the socioeconomic background of the communities that we serve. This gives us an opportunity to provide more coordinated care and tailored support for our patients. I genuinely appreciate the nomination and the recognition, and as stated, I have not done any of this alone, and I would like to thank my peers for all of their hard work, collaboration, dedication to the underserved communities where we continue to drive health equity and address the social determinants of health. Thank you.
I just want to say thank you so much again, just echoing what I said there and what Alexandria said earlier. I'm not sure where she went, but sometimes it was an effort of just me showing up with vaccine in partnership with Purdue Center for Health Equity and them bringing all of their interns and students. And it's not just a one-person job. Every pharmacist here knows that. I just want to say thank you for the recognition. Thank you, Lola, and Purdue Center for Health Equity for the nomination, and thank you, APhA, for the recognition. To all the pharmacists in here, it has been a wild ride, and I appreciate everyone. I've networked here. This is actually my first time here at APhA because of this award, and I will always come back. So thank you so much, and thank you, Walgreens, for my job and giving me this platform, and thank you, Lola. I cannot do a lot of what I do without them, and I love our teams. So thank you, guys. Thanks. Thank
Congratulations.
You. Thanks.
Thank you, Jordan, and thank you to our national winners. The next category is our Corporation Institution Awards. Focusing on wellness and prevention, and the creation of systems of care. These entries in this category have facilitated the development of practice models supporting pharmacists' immunizations roles. There are 2 recipients for honorable mention in this category. The first is the University of Southern California School of Pharmacy for their Los Angeles City COVID-19 vaccination program. In partnership with the City of Los Angeles' Office of Mayor and Fire Department, Carbon Health, Curative, and the nonprofit community organized relief effort known as CORE, they facilitated the mass distribution of COVID-19 and flu vaccine to Angelenos. USC worked closely with all partners and played an important role in developing the clinical, operational, and logistic considerations for the program. The mass vaccination sites included Dodger Stadium, the Los Angeles International Airport, Union Station, as well as mobile clinics. Pharmacists served as the lead at each site, working with multidisciplinary teams of clinicians. Accepting the award on behalf of the USC program is pharmacist Richard Dang.
Hi, this is Richard Dang from the USC School of Pharmacy, accepting the APhA Immunization Champion Award on behalf of the Los Angeles City COVID-19 vaccination program. This program was a collaborative partnership between the USC School of Pharmacy and Los Angeles Mayor Eric Garcetti. It was an amazing example of how a public-private partnership between pharmacists, other healthcare providers, community organizations, and public health organizations can come together and have a positive impact during the COVID-19 pandemic. I would like to recognize our partners in the program, including the Los Angeles Fire Department, Community Organized Relief Effort, or CORE, Carbon Health, and Curative. Through this program, in addition to community outreach and education, we were able to administer approximately 1.5 million doses of the COVID-19 vaccine in the city of Los Angeles from December 2020 to December 2021. Our vaccination program was able to overcome major challenges and barriers to serve as a model for vaccination efforts across the country. Some highlights of our vaccination program included establishing the first public vaccination point of dispensing or pod site for both healthcare workers and the general public, starting as early as phase 1A. At one point, operating 8 fixed pod sites across the city, running the largest mass vaccination site in the nation at Dodger Stadium that at its peak administered 12,000 vaccinations per day, and operating a vaccination program that utilized mixed models, including walk-up, drive-through, mobile units, home visits, and homeless strike teams. Some of our other notable sites included Union Station, the Los Angeles International Airport, Lincoln Park, Southwest College, USC Exposition Park Campus, and Cal State Los Angeles Campus. Our vaccination program also provided valuable lessons learned that were adopted by the LA County Department of Public Health, California Office of Emergency Services, or Cal-OES, and even FEMA operations. At the core of the city's program, the USC School of Pharmacy served as a key partner that placed pharmacists at the center of its operational, logistical, and clinical decisions. Our pharmacists conducted the clinical and vaccine administration training of the healthcare personnel within the program, served as a clinical consult that provided guidance and oversight in accordance to CDC recommendations, served as the site lead of each fixed and mass vaccination site, and oversaw the entire vaccination process from storage, preparation, tracking, and administration at each site. Throughout the process, the role of the pharmacist continued to advance and be highly valued by our partners. As each new site opened, one of the essential requests was always to ensure that we would be able to staff the site with a team of pharmacists. The vaccination program was a major undertaking, and collaboration, coordination, and communication between all partners was essential to its success. Thank you.
Good evening, everyone. Thank you to APhA for the recognition on behalf of the USC School of Pharmacy. 1.5 million vaccines, that was a huge undertaking, and certainly we required a massive coalition of companies and individuals, and I really want to thank everyone for their time, and especially our USC School of Pharmacy faculty, staff, and students, but also the student pharmacists from all the local Southern California universities as well who contributed to the process. And we also had dental students, medical students, and nursing students, and PA students who participated. We had a roster of well over 1,000 individuals, and I want to thank everybody, and that was just through our program. Employees, we had well over 5,000 involved. I just want to thank every single individual who made this possible, and thank you to Dean Vasilos Papadopoulos for his unwavering support of our efforts, and thank you to the LA City for allowing a pharmacist to take a central forefront role in this incredibly valuable program, and I'm honored to be able to represent the profession of pharmacy, and I must say, I feel like I'm with my people here tonight. I feel like every single person here understands the struggles that we went through of 20-hour days and the confusion and all the work that we did. So thank you all for your work, and thank you for joining us this evening.
Thank you, Richard, and thank you to the USC program. Our second honorable mention this evening is the West Virginia University School of Pharmacy. The university played an integral role in COVID-19 immunization response at the state level. The School of Pharmacy had a clear focus on saving the maximum number of lives through immunizations, especially the most vulnerable populations. Faculty were among the first in the nation to administer COVID-19 immunizations at long-term care facilities. Their innovation to go first and include all willing and able pharmacies received recognition at the national and international news organization level. There were many instances where faculty administered immunizations in unique settings to ensure that patients who wanted the vaccine were able to receive it, to minimize wasted doses, including dental and optometrist offices, manufacturing plants, individual patient homes, and coal mines. With no blueprint on how to conduct vaccination clinics at some of these locations and ever-changing guidance from CDC and the state, the team quickly developed strategies and modified as needed. Accepting the award on behalf of the West Virginia University School of Pharmacy is pharmacist Gretchen Garofoli.
I am honored to accept this award on behalf of the West Virginia University School of Pharmacy COVID-19 vaccination team, known at our institution as the COVID Conquerors. Our team consists of Drs. Ashley Barrickman, Betsy Ellswick, Marina Galvez Peralta, Gretchen Garofoli, Angela Goodhart, Heather Johnson, Ashley McMillan, and Dean William Petros. We want to extend our thanks to the APhA Immunization Champion Awards Committee for selecting us as one of the 2022 recipients of the Honorable Mention Award in the Corporation Institution category. We are extremely honored to be selected. In the words of APhA past president, L.B. Brown, pharmacists provide care, and all of us and so many others have done that and much more throughout this pandemic. All pharmacists, student pharmacists, and pharmacy technicians deserve a moment of recognition for all that they have done. We are thankful for our pharmacy colleague and member of our team who represents us at the state level, Dr. Krista Capehart, for trusting that pharmacists in our state were up for the task of completing the largest vaccination effort that any of us have ever undertaken. At the long-term care facilities, West Virginia University School of Pharmacy faculty collaborated with nurses and physicians to administer COVID-19 vaccines to residents and staff. We also collaborated with the university's Strategic Planning Office as well as WVU Schools of Medicine and Nursing faculty and students in the pharmacy-led immunization efforts. Through these collaborations, we were able to host large clinics helping to protect many at our university and in the surrounding communities. There were also many instances where faculty administered immunizations in unique settings to ensure patients who wanted the vaccine were able to receive it and to minimize wasted doses. Challenges drastically changed from the beginning of the COVID-19 vaccination effort to late spring 2021. There was not a blueprint on how to conduct vaccination clinics at a large university, thus the team quickly developed a strategy and then modified it as needed. There were numerous opportunities to collaborate with other healthcare professionals, including those from WVU Schools of Medicine and Nursing, as well as the Student Health Service. Those partnerships solidified interprofessional relationships that can be utilized for future outreach initiatives. We are thankful to them for assisting at all of our clinics. We would also like to thank the administration at West Virginia University and the members of our interprofessional team, Dr. Carmen Burrell, Dr. Lisa Costello, Dr. Clay Marsh, Dr. William Ramsey, and Aaron Newmeyer for entrusting us to carry out the COVID-19 vaccination efforts for the university and for their constant support. Finally, we are thankful for our families, friends, and significant others who encouraged us throughout this endeavor. Thank you all again. We are truly honored to receive this award. All right, as thanked everybody, I think, in the speech, but just a shout out to those who are here, especially our Dean, William Petros. He was not only at all of the clinics drawing up doses, but supported all of us through all of these vaccination efforts and initiatives. And of course, we'd be remiss if we didn't thank Dr. Krista Capehart, who was the brains behind the entire operation in West Virginia, and I don't think has slept since the beginning of the vaccination effort. So thank you to Krista, thank you to Bill, and thank you to everybody for this recognition. We appreciate it.
Thank you, Gretchen, and congratulations to the West Virginia University. Our national award winner in this category is Kroger Health. They also have their cheering crowd here. Kroger played a critical role in helping distribute and administer the COVID-19 vaccine. They were equipped to respond quickly to the needs to report vaccinations to public health authorities, supported by their automated immunization registry reporting. To combat transportation insecurity, Kroger Health partnered with Lyft Healthcare to provide discounted rides to and from vaccine appointments. They partnered with healthcare technology company to create a seamless experience for providers with enhanced access to health information, including vaccine records and population health alerts for indicated vaccines. They hosted hundreds of mass vaccine off-site clinics while contributing to realize the impact being accessible through the community grocery stores can have. Kroger invested in initiatives to provide education and encourage vaccination through their vaccine support call center, partnering with IBM Watson to create an AI-powered, seamless phone experience for patients. They also utilized vaccine text messaging to inform patients when they became eligible for a vaccine. To help increase vaccination rates in underserved communities, they partnered with the Major League Baseball Players Association and 10 of the league's teams, as well as other entities, to access communities and deliver vaccine confidence messaging. Accepting the award on behalf of Kroger Health is Colleen Lindholtz, President of Kroger Health.
Hi, I'm Colleen Lindholtz, President of Kroger Health. Thank you, APHA, for recognizing Kroger Health with the 2022 National Immunization Champion Award. I'm delighted to accept on behalf of our team of 22,000 healthcare professionals, including pharmacists, technicians, nurse practitioners, and dietitians, all valued members of their immunization neighborhood. We strive to practice at the top of our licenses, and we're proud to have delivered nearly 11 million COVID-19 vaccinations to date. Kroger Health's mission is to simplify healthcare for customers. During the pandemic, we improved immunization rates across the country through a variety of strategies. We built infrastructure that enabled the quickly changing rollout of COVID-19 vaccines, implementing online 2-dose appointment scheduling, updating eligibility by jurisdiction up to 3 times a day using an interactive chatbot to screen patients, and expanding our channels of communication to meet our customers' needs. To improve care coordination, we implemented a connected care platform, creating a seamless experience with enhanced access to health information like vaccine records. We partnered with Lyft to combat transportation insecurity by providing discounted rides to and from vaccine appointments, using the first hour of our daily operations inside of our stores as a focus time for administering only vaccines. Kroger Health teams also hosted hundreds of mass off-site vaccination clinics, serving up to 14,000 patients in one weekend. To help increase vaccination rates in underserved communities, we partnered with the Major League Baseball Players Association and 10 of the league's brightest stars to inspire people to take one for your team and choose to get vaccinated. Kroger Health also sponsored a community immunity giveaway campaign. Customers and associates had the opportunity to win life-changing prizes like $1 million payouts and chances to win free groceries for 1 year. And a $100 vaccine payment is offered to all Kroger associates who are fully vaccinated. With so much change over this past year, we find ourselves prioritizing and working differently than ever before, making deliberate decisions rooted in our vision to help people live healthier lives. Through each challenge, the Kroger Health team has personified resilience by showing up for our patients and for each other. Thank you again for celebrating this team of inspiring providers who embody an immunization champion. Man, it is awesome to be here tonight. I thank you, APHA, and the selection committee for bestowing this award upon the Kroger Company. It means so much to us. I want to thank my team and all of the Kroger Health associates, the 22,000 people, are from our pharmacists to our nurse practitioners to pharmacy technicians to our interns to our patient care techs that were out there on the front lines of the front lines the past 2 years, really saving lives. And it's just been an honor for us. And then I can't forget our partners. I mean, thank you, VaxServe and Merck and Moderna for being there for us. We could not have done it without you. You know, the constant connection that you had with us, the communication most definitely allowed us to do what we were able to do. So at Kroger, our purpose is to feed the human spirit, and this most definitely was a testament to who we are at Kroger. You know, being able to help the communities and save lives. It's an honor for us. So thank you.
Thank you, Colleen, and congratulations, Kroger Health. The next category is our Community Outreach Awards that focus on the ultimate goal of why we all work so hard in the area of immunizations. That's to improve the health of our communities. There are 2 honorable mentions in this category this evening. Our first recipient is Mayank Amin, Chief Patient Advocate and owner of Skip Back Pharmacy. Dr. Mack, or also known as Superman, as he is known in his community and nationwide, rose to the call of his community since the beginning of COVID. He knew there was a great need in the community for protection against the virus and wanted to help in any way possible. He actively engaged many players, including 700 community volunteers, to launch the effort to address the public health needs of his community. Whether snow, rain, or anything else Mother Nature could throw at him, they persevered. They created a COVID task force that administered more than 80,000 COVID vaccines in his community. In addition to administering and distributing thousands of COVID tests and vaccines, they met whatever the community needed, whether in homes, within clinics for individuals with physical and intellectual disabilities, or other identified needs in their community. Please welcome pharmacist Mayank, Dr. Mack, Superman, Amin.
Dr. Mack, a local pharmacist and the owner of a mom-and-pop pharmacy in Skip-Back, has gained national attention over the past few months for his work vaccinating more than 45,000 Pennsylvanians against COVID-19, all while wearing his now famous Superman costume. While it may feel like a distant memory, it was barely 4 months ago when our counties and healthcare providers, particularly our independent pharmacies, were struggling to procure doses and put systems in place to make appointments, maintain waiting lists, and manage operations. What started with 2 volunteers and 1,200 doses on a snowy Super Bowl weekend turned into countless weekend clinics with hundreds of volunteers serving thousands a day. And to date, Dr. Mack and his legion of volunteers have vaccinated more than 40,000 adults and 5,000 teens across the Southeast. They made special efforts to reach seniors, veterans, and disabled individuals. They held clinics for autistic and sensory-sensitive individuals. Without Dr. Mack and the wonderful staff and volunteers at Skip-Back Pharmacy, Montgomery County, southeastern Pennsylvania, and our Commonwealth would not be where we are today in terms of our rising COVID vaccination rates and declining case rates.
As pharmacists, we took an oath to consider the welfare of humanity and relief of suffering our primary concerns. This was our opportunity to advance our role as pharmacists and answer the call. When I came back from the firehouse the night of our first clinic, I had over 1,000 voicemails and emails from patients, doctors, hospitals, the news, and the government. While many were seeking to receive the vaccine, others were jumping in asking how they could join our immunization neighborhood and fight COVID-19 head-on with these vaccines. Alone, I could only administer a handful of vaccines and provide just another shot. But I knew that extraordinary times require us to look beyond the script, outside of the box, and go the extra mile to not only provide a vaccine, but to provide an experience these patients will remember for the rest of their lives. And this is the mission we set out for. This past year, I realized that those helping me weren't just ordinary people who were volunteers. They were superheroes. They were other healthcare professionals, members of the community, members of the government and media, folks from our county and Department of Health, and leaders like Mitch Rothholz, who I sought advice from with every single decision we made. The amazing thing is that each person selflessly put in their 110%, sacrificed thousands of hours away from their families and hobbies with one goal in mind: to fight COVID-19 together. And because of it, our story was heard throughout the world. Immunization rates in our county went from being amongst the lowest to being one of the highest in Pennsylvania, and together with the help of 1,000 volunteers and team members, we were able to administer over 75,000 vaccines. We were presented with many challenges along the way: a shortage of vaccines and supplies, a shortage of time, but there was no shortage in the amount of passion and dedication that each person in our superhero task force had to keep going. This award is dedicated to their blood, sweat, and tears that each person on our team has put in. Our vaccines have saved lives, but they've also helped to create an immunization neighborhood, given our profession new light, and brought together the world for one fight and one cause. This experience has shown us that together, nothing is impossible. You are all superheroes. It was October 2020. 2 blue stripes showed up on a little test. And that wasn't a COVID test. It was a pregnancy test that my wife had taken. As we looked ahead, we realized that COVID was still here. What were we going to do when our child was born into a world filled with COVID and not love? So we decided to take the mission head on. We had a fantastic team of students, a couple of the students, Erica, who's now a pharmacist, Jocelyn, who's here at the conference as well, folks in the community that just wanted to help. Who knew that members from APHA lived in our community, like Mitch? He came to the pharmacy when we got our first doses of vaccine and opened that box of COVID vaccines like it was the best present we've ever received in our lives. February 7th came, the Inquirer came to the pharmacy and asked us, what are you going to do? There's a blizzard happening tomorrow in your county. The state is going to be in a state of emergency, and you have all these vaccines. Well, that's when I said, no matter what, COVID is going on right now, and people are dying every minute that we wait. These vaccines will be administered tomorrow, and the community will show up. And boy, did they show up. As we move forward, we realize that none of this would have been possible without the support of our team, the COVID task force, everyone in this room, all of the pharmacists, pharmacy technicians, and students throughout the country on this fight together. Thank you all. You are all superheroes.
Thanks, Superman. Our second honorable mention recipient is Ed Houdan. Ed is the owner of a medicine shop. His immunization efforts have allowed him and his patients to catch up and receive vaccines they never had before. He organized annual influenza and shingles vaccination clinics specifically for nursing home patients, as well as walk-in availability for routine vaccines to anyone who wanted to get vaccinated. He sends alerts to remind patients of vaccines they need and counsels patients on vaccines when they pick up their prescriptions. He tackled head-on vaccine hesitancy. Many patients grew weary of the COVID vaccine and all vaccinations. After copious misinformation that was spread on the internet and news, Ed met with local newspapers and news stations to deliver messages to the community about the safety and efficacy of the vaccines. He coordinated with a state representative and the Department of Health to bring 40,000 COVID-19 vaccines to his county and coordinated with his school district to conduct mass clinics in addition to those offered at his pharmacy. He engaged his entire community in his effort and demonstrated the value of the neighborhood pharmacist. Please welcome pharmacist Ed Hudon.
Hi, it's Ed Hudon from the Medicine Shop Pharmacy in Boyertown, Pennsylvania. My wife Terry and I have owned the pharmacy for about 28 years now. We are a small community in Berks County, and we've been fortunate enough to vaccinate close to 60,000 people. But I wouldn't have been able to do that if it wasn't for a lot of people. A lot of people spanning across the United States. I was able to learn, hone my skills, have the confidence to do what I do because of people stretching from PPCN, Pennsylvania Pharmacy Care Network, and Stephanie McGrath and Kristen Hartzell in Pennsylvania to Troy Trigstad and Cody and CPESN. All these people just gave me the courage and the ability to create a plan and execute a plan to vaccinate our community. I believe we were able to vaccinate so many because of our community ties, about great communication, and just a sense of caring. When you care, when you truly care, you can do great things. I'm passionate about helping people emotionally and physically get through this pandemic. And vaccination efforts gave people a great sense of hope to come through on the other side. Now, in Berks County, we are very vaccine hesitant. People ask how I was able to vaccinate so many. Well, I think it's about being empathetic. And I don't judge, I just educate. I tell people where to look for information and where not to look for information and who to trust. It's not a political endeavor. It's a healthcare. It's a biological effort. It's a science effort. I've had people that wanted, fraudulent cards, and I didn't shame them about them asking me. What I did was educate them. And I was very successful in getting them vaccinated by giving them honest information and by not shaming them. Community is about people, and people all have different values and they all have different quality of life measures. And I think once we start listening to those and understanding where they're coming from, we can then have a conversation, and that conversation can lead to great things. I'm able to communicate and be stronger at what I do through my ties in the pharmacy organizations throughout the United States. I was never like that until right before the pandemic, when I enrolled in Flip the Pharmacy and met Stephanie McGrath. And I now, at 54 years old, feel like I am at the top of my profession and doing all the things that I love to do and I've always done in my community to a greater level and to a greater extent because of that newfound confidence. Our stakeholders range from the commissioners in Berks County to the emergency operators, to church groups, to the Department of Health. All these people worked within our group so that we could vaccinate to this level. I thank everybody, my family, my community.
And it cut off. So I have a special thank you because my family went through a lot. My wife is a great pharmacist, a great role model. She held me up all those days. She sat there billing and making sure everybody was in check. My kids who opened Band-Aids and got supplies ready. Thousands of volunteers across the state of Pennsylvania and in New Jersey. We can do great things together, but it's that touch, that emotion that we saw at those clinics. My wife came over after our first clinic and she was tears in her eyes. Like, what's going on? She's like, it was joy. There was so much joy at those clinics. There was hope. There was value. And there was a passion to get through this, hopefully a little bit stronger and a little bit more connected. And that's what I hope for us as pharmacists. We have to stand together, advocate for each other so we can advocate for our patients, because they need us. We as pharmacists have so many great things to offer. I think we sort of forgot that, and I think we're coming through this on the other end knowing that we can do this together, bringing communities together, making us stronger and healthier. So I thank you, I thank APHA, and I thank all my peers, because I couldn't have done it without all of you teaching my wife and I what we needed to do and how to protect us all so that we could get through this and start doing what we do best, take care of our patients. Thank you.
Thank you.
Thank you.
Congratulations, Ed. The national winner for this year's Community Outreach Award is pharmacist Jennifer Twyla. Jennifer has worked tirelessly on the COVID-19 pandemic response to provide immunizations not only to hospital associates, but also the community at large. Under her leadership, she opened multiple community sites across the community to vaccinate the populations they serve more efficiently and rapidly. She created events to bring vaccinations to corporations like FedEx rather than ask employees to travel to a clinic. She partnered to administer vaccines at community events that donated 1,000 back-to-school backpacks. Dr. Twyla has placed pharmacy at the forefront of vaccine administration and has shown how valuable our profession is. Accepting this award on behalf of Jennifer Twyla is Casey White.
Hi, I'm so honored to receive the 2022 Immunization Champion Award for Community Outreach. The last 3 years have been so challenging and disruptive to our social and professional norms. With the advancement of the COVID-19 vaccine, it brought about a big sigh of relief for many, including myself. But with that relief also came the immediate need for pharmacy teams to begin strategic planning for their health systems to ensure they had a smooth vaccine rollout to their associates and providers. Not long after that, what would follow was a massive educational and vaccine push to at-risk patient populations in the community. As I look back on our journey at Methodist Healthcare to vaccinate our community, it definitely took a team approach with a lot of caring associates who wanted to give back to their community by working vaccine events. It also took a strong relationship with community partners to help engage the community, their staff, and their congregations. And it took dedication from our pharmacy teams across the system to push forward despite other challenges we were faced with in the hospital. One of the things that I'm most proud of through our vaccination efforts is how far our reach extended into the underserved patient populations. The partnerships with the key community leaders, large companies, school systems, and church leaders to engage and educate those underserved populations was paramount to successful vaccination efforts for Memphis and the surrounding communities. This could not have been done without the help of our Methodist Congregational Health Network, the Methodist University Specialty Clinic, and Mississippi Boulevard Christian Church, and the leaders from our school systems. That's just naming a few of the key players. We also engaged key thought leaders in the community that understood the importance of vaccination and dispelling any myths related to vaccine misinformation. It was key to provide a presence from different minority groups to advocate for vaccination by stepping up and being vaccinated themselves and then promoting vaccination at these events. Although tough to manage and coordinate at times, throughout the whole community vaccination process, I felt so much support from the senior leaders at Methodist, an enormous amount of support, encouragement, and perseverance from my pharmacy team, and last but certainly not least, a lot of love and motivation to keep doing what I do best for my husband. A lot of time was shifted away from my own family, my 3-year-old little boy, to help others during this time. And I couldn't be more grateful, though, to have the love and support from my family and friends. I just kept telling myself throughout the process that this is bigger than me, which reminds me of the quote, "She believed she could, so she did." Again, thank you so much for this recognition. And this one is really a team award for the whole Methodist Health System, with a special shout out to my pharmacy teams.
I know that Jennifer Twyla is sad that she couldn't be here. She's probably even sadder that I'm here to accept it for her. There's lots of qualities I could tell you about Twyla. That's what her close friends call her. But I'll probably stick with the positive ones. She is, she works tirelessly. The one thing that you can say is that she truly cares. We all hope that we never lose the care, right? Well, Jennifer has it in spades. So thank you. I want to personally thank you and this organization for recognizing her tireless work for her community. So thanks.
Thanks, Casey, and thanks, Trella, for your hard work. The next award is the Pharmacy Team Member category. It was established to recognize individuals who are not pharmacists and advocate for immunizations and support pharmacist-delivered immunizations. Individuals could include pharmacy technicians, store managers, or other support staff. The significance of the role became even more critical during COVID-19. The national winner in this category is Amanda Hiddle.
Hey everyone. First of all, I'd like to say thank you for allowing me to be an immunization champion for the APHA. I'm really honored to have been a part of immunizing during the pandemic, and I really look forward to seeing where it takes us in the future. So as a technician, being able to immunize, I feel like we have been able to reach a much larger portion of our community than we would have been if I weren't able to. Because anyone that's worked in a pharmacy knows we all have more technicians than we do pharmacists. So I think it's really been a huge part of being able to immunize as a technician and being able to support our community and our pharmacists so we can continue regular business operations and still meet this huge public health need. Many community members here in our area, as patients and just as people that knew our pharmacy was here, didn't know we were able to vaccinate. So that's been a huge part of just community outreach and making sure that they know that we're here for them and we're here to help them with their immunization needs. Most of our patients have a pretty strong level of trust with their pharmacists. They see the pharmacist all the time, and so they see us here as technicians and as patient advocates and all of that. So they have a trust level with us that they may not have with their doctor because they're not always able to see the doctor. So it's neat that we're able to also say, hey, not only can we help with your medications, but we can also help with your immunizations and your overall health. So that's been really cool. In our community, there's absolutely no way we could have vaccinated all the people that we have without our community. There's a church in our area that was phenomenal with getting us volunteers and a space to be able to immunize thousands of people at a time. So we are more than thankful for all of those community members, our pharmacy students in the area, nursing students, our Arkansas Department of Health. They've all been crucial in making sure that we could get our community taken care of. I'm also a public health major. Not only am I a certified pharmacy technician, so it's been really cool to be able to educate people and explain public health and say, hey, you know, not only is this about you and protecting you, it's also about your community and the people around you that maybe can't get vaccinated or aren't eligible at the time. So it's been really neat to be able to explain public health and explain how important primary prevention really is. And this is, I feel like, the first opportunity that we've had in my career to really say immunizations are super important, and this is why. We can say that about daily vaccines all day long, but this is a different experience. People have never been part of a pandemic before. And so I hope that this will help them continue to not only get their COVID vaccine, but get that Shingrix shot, get the pneumonia vaccines. You know, let's really understand where this is going. So I want to say thank you again, and I am super excited to see where we go from here.
I was definitely watching my 2-minute timer during that. I was afraid it was going to self-destruct in 2 minutes if I didn't stop. I just want to say thank you to the APHA, definitely, for bringing technicians into this. I think that we've made huge strides in the steps for pharmacy, and I know we've been through a lot the last 2 years, but I definitely think it's been worth it. We've made great strides in pharmacy and great connections with our community. I know in my community, they speak 3 different languages, and we've been able to vaccinate across that. So like everybody else, I definitely want to say thank you to my family. Thank you to my dad for helping me through this. But my biggest thank you goes to my community. So to them, I say thank you, gracias, and como tada. Thank y'all.
Thank you, Amanda, and thank you for all you do. Our next award category is the Friend of Pharmacy Award. This award recognizes an individual who is a non-pharmacist and has supported and facilitated pharmacists having a role in immunization, an expanded role. The work of our recipient this year has made a major impact on advancing the immunization and public health role of pharmacists. Will Chang was employed by the Department of Health and Human Services, HHS, early in the pandemic and utilized his understanding of accessibility of the pharmacy workforce in guiding decisions for amendment to the PrEP Act, which resulted in fully enfranchising the pharmacy workforce through COVID-19 pandemic. He asserted throughout the process that pharmacists and the Federal Pharmacy Network are not, if they're not effectively engaged, there would be no practical way that we'd be able to address the equity of vaccine and public health services during the crisis. Ladies and gentlemen, please help me welcome this year's Friend of Pharmacy, Will Chang.
I would like to thank the American Pharmacists Association for this recognition. For over 2 years now, we have taken an unprecedented journey. At times, that journey has humbled us and divided us. And at times, that journey has strengthened us and brought us together. The journey of America's pharmacy community throughout this pandemic is one of strength and unity. From national retail pharmacies to independent community pharmacies, you have vaccinated our families, our friends, and our communities. From our cities to our rural areas, you have made vaccinations more accessible. You have patiently and knowledgeably answered our questions and addressed our concerns. And you have done so under some of the most trying conditions. At the U.S. Department of Health and Human Services, and now at McKesson, it has been a privilege to support the work of our pharmacies. This recognition that I am now receiving does not belong to me alone. It belongs to the team and partners who share their expertise, time, and commitment. It belongs to my current colleagues at HealthMart and in the larger McKesson family who exemplify a patient-first commitment in all that they do. And it belongs to my wonderful and beautiful wife and 4 children who are much more than I deserve. As we move forward, let's build upon our shared mission and our successful partnerships. All healthcare professionals, whether pharmacists, nurses, physicians, or other healthcare providers, have a shared mission to advance healthcare outcomes for all patients, no matter where the patient lives and no matter the race, ethnicity, or income of the patient. And we're much better able to close those gaps in health equity if all healthcare professionals work together, coordinating care and delivering value with the patient at the center. When the patient wins, we all win. Strong public-private partnerships can redefine what is possible. Over the last 2 years, state, federal, and local governments worked with private industry and healthcare professionals to tackle the greatest public health challenge of our time. That partnership produced highly effective vaccines and built a nationwide vaccination distribution and administration program in less than 1 year, all when so many doubted whether it would be possible. When we trust each other and when we work together to put the patient first, we have and can continue to redefine what is possible in public health. Thank you again. God bless you and God bless your families. Take care.
I was listening to one of the comments made earlier, reminding us of the importance of asking for help. When America needed help distributing free HIV prevention medications in underserved communities, pharmacy answered, donated its dispensing and counseling services, and it delivered. When America needed help setting up testing sites all around the country in socially vulnerable communities, again, America's pharmacies delivered. After the tragedy of George Floyd's murder, after the heartbreaking civil unrest, after getting reports at the HHS Command Center of so many pharmacy testing sites being disrupted, in some cases destroyed, and then seeing the very next day that these pharmacies, many of them were opening up alternative sites to continue testing in those communities. That was help that was inspirational for all of us. In 2020, when we were trying to figure out how to turn around the troubling drop in child vaccination rates, and I needed help to figure out what this framework was, why in the world in one state pharmacists can vaccinate a 3-year-old, in another state a 7-year-old, in another state 18 and over, I asked Google for help. And then Google told me to ask Mitch Rothholz for help. He spent hours and hours on end helping me understand this complex web of state scope of practice restrictions. And then, of course, with Operation Warp Speed, manufacturing. The development of vaccines gets a lot of press, but it's only one part of it. There's also manufacturing, distribution and administration, shots and arms. What good is a vaccine with over 90% efficacy if it doesn't get in people's arms? And we knew we need our partners again, America's pharmacies. You know, I think back to 2016 when my very young daughter was having trouble breathing. It was a Saturday night. I took her to the ER, and it was late, and I needed a nebulizer. I needed to figure out how to use it and all the drugs that the ER doctor had prescribed. I turned to our local Vienna, Virginia community pharmacy for help. He stayed open past hours and spent as much time as I needed so I could feel comfortable that my little Eleanor would be able to breathe that night. And finally, when we thought about how to deal with all these legal barriers across the nation that stood in the way of our pharmacists fully being unleashed and helping our country with all of the troubles of COVID-19, you know, I turned to my wife for help. She's a much better lawyer than I am. At the time, she had her own difficult legal challenges being the Deputy General Counsel of the FBI, but she patiently listened to all my questions and all my different theories about federalism, preemption, how to deal with state scope of practice rules at the federal level, and she was a great source of help. So as we look forward, you know, when you looked at that video, I just noticed on that stand next to me in that red binder, there was actually a copy of the recent CMS proposed rule on pharmacy DIR fees. And I look around at the folks in this room who have been on the phone with me quite a bit, whether it's DIR fees, the future of pharmacy, long overdue Part B recognition for pharmacists, and so many other issues. We're in this together, and I really look forward to asking you for help and being a source of help. Thank you.
Thank you, Will, and thank you for all of your efforts that helped us through the getting authority and all the challenges that we faced. The next award is one that is reserved for a special individual who has had a career that has led to significant improvements in our nation's health and expanded roles for pharmacists. Before tonight, there were only 4 other individuals in the 14 years since establishment of the Immunization Champion Awards. Steve Foster in 2010, Dennis Stanley in 2012, Bill Atkinson in 2018, and Jeff Goad in 2019. These individuals have received this award in the past. I have known this year's recipient for many years, from early in his pharmacy career when he was a student pharmacist. He was APHA executive resident, where he was involved in the creation and teaching of the first immunization training program, which has evolved into APHA's gold standard pharmacist-based immunization certificate training program. This fueled the movement for pharmacists' involvement in immunizations. Dr. Hogue has personally assisted states in securing immunization authority and practice expansion for vaccine services. He's partnered with public health throughout his career and served and is serving on the ACIP COVID task force, as well as he's serving in his own community as COVID-19 vaccine incident commander for the entire Loma Linda University health system, a pharmacist leading a healthcare system's COVID response team. Hogue has been elected to many state, and national association leadership positions. The most significant leadership role was serving as APHA president during COVID. His engagement, advocacy, and expertise and guidance was invaluable to the profession as we responded to the increased demands for our services. He has served on numerous ACIP and CDC work groups and currently serves as APHA's representative on the ACIP COVID-19 work group and as our liaison representative to ACIP. For his career achievements and contributions to the advancement of immunization role for the pharmacy team, we are pleased to present this year the 2022 APHA Immunization Champion Lifetime Achievement Award to Dr. Michael Hogue.
Thank you to APHA for recognizing me with the Immunization Champion Lifetime Achievement Award. Particularly thanks to Steve Foster, my longtime friend, whom I consider a brother, for nominating me. When APHA began the National Immunization Initiative in the mid-1990s, the task before us was enormous. Only 9 states allowed pharmacists to immunize, and very few pharmacy schools in the nation taught pharmacists about vaccines in the curriculum. APHA rapidly deployed a high-quality training program for the pharmacist workforce, and a handful of us went about traveling the country training pharmacists to administer jabs and to screen patients for comprehensive vaccine needs. We trained the first pharmacists in Mississippi in the fall of 1996, and I knew back in 1997 when I returned to Alabama that I had to put into practice what I'd been preaching. So I entered into the state's first protocol and gave the first shots from a community pharmacy by a pharmacist in that state. It's hard for me to believe that it's been over 25 years of vaccinating now. Most recently, pharmacists, student pharmacists, and technicians have been the heroes of the healthcare setting during the pandemic. And it's gratifying to know that I had at least some small part in catalyzing the initiative that prepared us for this moment in the profession's history. Finally, I want to thank several other friends and colleagues. To John Gans, Mitch Rotholtz, Lucinda Main, David Schulke, Patricia Jackson, Elizabeth Keys, and James Appleby, and I'm sure a host of other APHA staff that I failed to mention, thanks for giving me the chance to be a part of something that turned out to be transformational for our profession. And to John Grabenstein and a handful of pharmacists who traveled the roads in the early days doing the training, thanks for being pioneers and leading the way. Thanks also to my wife Heather and daughters Olivia and Annalise for always being supportive, even if it's meant more nights away from home than any of us might have wanted. And thanks to you, all of the pharmacists, student pharmacists, and pharmacy technicians listening to these remarks. Keep doing great things and saving lives through vaccination.
Thank you all very much. I just have to say that I saw in awe, I just looked in awe at what pharmacy was doing during the pandemic. It blew my mind. I mean, when the COVID-19 work group started up during the pandemic, the CDC immediately contacted Mitch and said, we've got to have a pharmacist on this work group. For what it's worth, not every work group at CDC has a pharmacist on the team, but they knew, as Will Chang said earlier, the feds knew that pharmacists were going to be critical to making things happen. And I just can't tell you the pride that welled up inside of me when I saw pharmacists in every little small town in America stepping up and doing exactly what I knew pharmacists would do. It was amazing. One very quick story. In the very early days, as we were going around the country trying to train trainers to get prepared, Steve Foster and I, and he's like a brother to me, were comparing notes on all of the major corporations that were involved in immunization, and Steve and I deduced that either he or I trained the trainers for every corporation in the United States, and it was a really cool thing. So I'm not saying that to brag. I'm just saying that I want to thank my wife. She's right back there. Heather is a pharmacist, and it took me 12 years to convince her to give immunizations after we got started, but she's been right by my side, and I'm very proud of her too. Mitch, thank you, and thanks everybody. I look forward to seeing you for the rest of the conference.
Thank you, Michael, and thank you for all you have done on behalf of the profession and the communities we serve. I hope after seeing everything tonight, you recognize that today is the day. Today is the day that we are moving forward to advance the role of pharmacists in immunizations and other critical public health services. Thank you to our sponsors for this evening's event, CDC, GSK, Merck, Moderna, Pfizer, and Vaxserve, for your support for this year's awards program, but your ongoing support throughout the year. Let's give one more round of applause for our supporters, our award recipients, and each of you. There is still food out, and I don't know if they took the bar away or not, but everybody enjoy the rest of the time networking, and thank you again for all you do. If the award winners would please come up to the front for a picture.